Hello everyone, today I am going to make a return demonstration on perineal care. So, proper assessment and care of the perineal area will need professional clinical judgment. Assess for any irritation, inflammation, swelling, excessive discharge, urinary or fecal maintenance. So the possible nursing diagnosis for this procedure are deficient knowledge and risk for infection. So for the materials that we are going to need, we are going to need gloves, sponge cloth, basin, waterproof pad, towels, soap, toilet paper, and bedpan. So in the preparatory phase, we are going to introduce ourselves and verify the client's identity. Explain the procedure to the client and be sensitive to any embarrassment that the client may feel. This is to ensure that the right patient receives the right procedure and and to promote cooperation from the client and the patient. So good day, sir. Ako si Gasuni R. Herona. I am a student nurse from Central Mindanao University. So, pwede na ako mabawaan mong full name, sir. Kasi mong birthday, sir. So, check lang ako sa mong bracelet, sir, ha. So, karon sir, akong buhat si mo is magbuhat og perineal care, which is to limpyo ang imong perineal area, sir. This is to clean your perineal area and to check if there are any infections sa mo. Diyan ang parts sa mga awas, sir. Would that be okay, sir? Then, we are going to perform hand washing and observe other appropriate infection control procedures. This is to avoid the spread of microorganisms. Then, provide for client privacy by drawing curtains or closing the door. So, this is to eliminate the anxiety that the patient may feel during the procedure or lessen it. 1, 2, 3, go. So for the performance phase, fold the top bed linen to the foot of the bed and fold the gown up to expose the genital area. Then we are going to place the bath towel under the client's hips. This is for the protection of the bed and to avoid the bed from getting wet. Then we are going to position and drape the client and clean the upper thighs. So we're going to make a small window of the genital area. We're not going to expose his or her whole body. Then clean the upper inner thighs. So for the female in the perineal care, we're going to position the female in a back-lying position with her knees flexed and spread well apart. Then we're going to cover her body and legs with bath blanket. Drape the legs by tucking the bottom corners of the bath blanket under the insides of the legs. Bring the male portion of the base of the blanket up over to the pubic area. Put on gloves and wash and dry the inner thighs. So we are going to clean the labia majora. Then spread the labia to wash the folds between the labia majora and the labia minora. So we're going to separate. Then we're going to start with the side. After that is going to be make sure to use the right quarters of the washcloth for each stroke and wipe from the pubis to the rectum. For menstruating women and clients with indwelling catheters, use clean wipes, cotton balls, or gauze. Take a clean wipe for each stroke. So again, we're going to separate the labia. Start with the side. Again. Side. Then I am going to rinse the area well and dry the perineum thoroughly. For the male part in the perineal care, we are going to position the male client in a supine position with the knees slightly flexed and his hips slightly externally rotated. Put on gloves and wash and dry the upper inner thighs. We're going to inspect the perineal area for any signs of inflammation, excoriation, or swelling, especially between the labia in the females or the scrotal folds in males. So we are going to wash and dry the penis using firm strokes. So the firm strokes is what keeps or avoids the male patient from having an erection in his penis. So if the client is uncircumcised, we are going to retract the prepuce foreskin to expose the glans penis for cleaning. So the foreskin is located in the top part of the penis, so we are going to retract it and replace and proceed to clean it with in a circular motion. So wash and dry the scrotum. The posterior folds of the scrotum might need to be cleaned in step 19 with a buttocks. So inspect perineal orifice for intactness. Inspect particularly around the urethra in clients with indwelling catheter. So clean between the buttocks. We're going to assist the client to turn onto side. So sir, ako lang i-turn sa mo side. Yes sir, very good. And facing away from you. So what we're going to do is to pay particular attention to the anal area and posterior folds of the scrotum in males. So we're going to clean the anus with toilet tissue before washing it. If necessary, dry the area well. For post-delivery or menstruating females, apply a perineal pad as needed from front to back. Then we are going to dry it. And after the procedure is done, we are going to assist the client back to a comfortable position. So we're going to get rid of the pad underneath the client. She's going to the pin. So thank you for your cooperation, sir. Discard the, what did you call it? Discard the gloves. And that will be the end of the procedure. Thank you.